Sometimes there's just something that bothers you about your appearance and you want to change it.
That's exactly what a college junior at UConn was feeling about his ears. He worried they stuck out too far, so he decided to undergo surgery to fix the issue.
He went to the Stanislaw Plastic Surgery Center in Avon where we met up with him to learn about this procedure called Otoplasty. Louis Cruz has never been happy with how his ears looked.
It just stuck out a little bit, and I guess it wasn't really the bullying or anything else going on. It was really just a personal thing that I saw. As I said, I'm a perfectionist, so seeing that in the mirror and not feeling like it was right is what made me go forward with this procedure.
Louis is now in his junior year at UConn studying political science. As he thinks about what he might do after graduation, he decided to get otoplasty, a cosmetic surgery to change the position of his ears so they don't stick out as much.
The sooner the better is really what I thought.
His online research brought him here to Dr. Paul Stanislaw at the Stanislaw Plastic Surgery Center in Avon. Dr. Stanislaw says otoplasty is a wonderful option for people who don't like their protruding ears. He even does the surgery on children as young as 5.
5 years old, the ear is almost as big as an adult size, not quite, but pretty close. But it's also the age where kids are sort of getting a sense of their own body identity. It's when the kids start teasing kids and stuff like that. So just from a psychological standpoint, we usually do it like after 5 years old.
A child surgery would be done at the hospital, but for adults like Louis, the surgery can be done right in the office under local anesthesia.
What I do is I inject numbing medication to the back side of the ear, and then I inject some numbing medication to the front, like right around here, right around here. Generally takes me about 3 hours, 3.5 hours, depending on how much I have to do. The recovery varies from boy to girl. So if someone, or for your hairstyle. So if you've got someone with short hair, as Louis does, you're gonna basically have bruising that's gonna be in the front. And that bruising can take up to a month for that to go away. How long did your bruising?
It was about a month.
Dr. Stanislaw explains how the procedure works.
So right here is the helical fold, and right here you can see an antihelical fold. So when people have prominent ears, they're missing this part.
As a plastic surgeon, Dr. Stanislaw goes in and creates the fold that was missing.
The other component is the conchal bowl, and that's the cartilage that's sort of right in here. Sometimes people have very prominent ear cartilage that's in there, so that pushes the bottom part of the ear out. And when that bottom part sticks out, it sort of just takes the whole ear away from the head.
He's able to do the surgery so scars will be invisible, tucked behind the fold of the ear. Dr. Stanislaw explained everything to Louis before the surgery in a relaxed consultation in his office.
It's scary for me at the beginning too. You know, I'd never done a surgery before, so this was my first surgery, and I definitely think that coming into the office and meeting with Dr. Stanislaw and his receptionist was very nice, so it made me feel more comfortable.
Louis had the otoplasty when school got out so he could heal over the summer. He was open about his surgery with friends and family and is so glad he went through with it. Here's a look at Louis's before and after pictures.
I feel more confident. I feel like it was the right decision to make because you know, before it just bothered me. It was something that was always in the back of my mind. But afterwards, I don't even notice it anymore.
And to learn more about Dr. Stanislaw or to book a consultation for otoplasty, you can go right to his website. It's www.stanislawmd.com.